Dermatologists are able to take tiny, small samples of skin to check and see what type of itch is going on. But what information you give us, which is called the history, can also help us in determining what may be causing the itch. Is it from neurogenic itch? Is it from something you're applying? That is causing an allergic reaction or an irritation reaction? Is it a flare of an eczema in the area from multiple different triggers? Or is it a specific disease? Hello everyone, welcome to FunDERMentals with Dr. Adobe Obasi. I'm a physician scientist board certified in dermatology and dermatopathology. Today I want to change gears a little bit and talk about a very common complaint that I get in clinic, which is itching of the genital region, both in men and in females. The genital region has a lot of blood flow that goes to it and is subject to a lot of rubbing as well as irritation from potential products that are applied there. Here are 5 common reasons why the external genital regions can itch. The common reason is from an allergic contact reaction or dermatitis. Derm or skin, itis means inflammation. So this is an inflammation on the skin resulting from an allergen coming in contact with the skin. The allergens can either be things that we apply, things that we rub on the area, or even sometimes things we ingest. So there is inflammation that happens in the genital region, and part of inflammation is itch, which is similar to when you have allergic reactions in other parts of the body. In the same arm of this inflammation of the skin, you can also have irritants, which are not allergies, but they're things that irritate the skin, and it can also be things that are applied that can cause rashes and flares of inflammation. A common cause of genital itch is the use of wipes in the sensitive skin patient or the susceptible patient. So for these wet cloth wipes to stay on the shelf long enough to be sold, it requires some amount of preservative, no matter how gentle it's formulated. And so for sensitive patients, they may be sensitive to those preservatives and result in genital itching and rashes. Another cause of genital itch is actually nerve-related itch or neurogenic itch, which is common in patients that may have some lower back problems. And so the nerves that are going to the genital region from the spine get irritated by the inflammation of the spine on the lower back and cause itch or the arthritis on the lower back. With these type of neurogenic itches, I tend to refer patients to a neurologist or rheumatologist to address the underlying problem, because the problem is not the skin, unlike what I talked about earlier, which is the dermatitis, where the primary problem is from the skin side based on what is being applied. This is actually an internal problem that needs to be primarily addressed. A third reason for itch is having eczema in the genital region. So this may not be necessarily allergic or irritation, reaction, or inflammation. These are hypersensitive patients just having flares of their eczema from a collection of triggers that they come in contact with. The fourth reason for itching of the genital region is a condition called lichen sclerosis. Lichen sclerosis is a very intense inflammation that happens between the top layer of skin called the epidermis and the second layer of skin called the dermis, right where they meet. We call this the interface or the dermal epidermal junction, or DEJ. So at the DEJ, this very intense inflammation happens and destroys that layer of the skin, causing the skin to thin and be easy to have injury. These patients suffer very intense itching And with lichen sclerosis, it can have secondary effects of scarring the area. And in females can actually cause how the external genital region looks to change because of the scarring process, what we call agglutination. The fifth reason for itching of the external genital region is infections. It could be sexually transmitted or non-sexually transmitted infections. Bacterial overgrowth, yeast overgrowth can cause itching. You can also have itching from various sexually transmitted diseases. So whenever you're experiencing itching of the external genital region, it's important to follow up with a dermatologist or for females, OBGYN, or for males, urologist, or your primary care doctor, a physician that can help delineate what may be causing the itch. Dermatologists are able to take tiny small samples of skin to check and see what type of itch is going on, but what information you give us, which is called the history, can also help us in determining what may be causing the itch. Is it from neurogenic itch? Is it from something you're applying? That is causing an allergic reaction or an irritation reaction? Is it a flare of an eczema in the area from multiple different triggers? Or is it a specific disease? Please subscribe to this channel, click on the notification bell as well as the like button, and comment below if you have any questions about what I just discussed. You are all fundamentally awesome. I hope you have a wonderful day and God bless.